Can diabetic patients take sugar? A question that might raise some eyebrows, but today, we delve into the world of diabetes and sugar. Diabetes, a health condition that affects millions of people around the globe, is primarily characterized by high blood sugar levels. At the root of this condition is sugar, or more specifically, the body's inability to efficiently process it. But what does sugar actually do to our bodies, and why is it such a crucial factor in managing diabetes? Sugar, in its simplest form, is a type of carbohydrate. When we consume it, our body breaks it down into glucose, a primary source of energy. However, for this energy to be utilized, a hormone known as insulin is required. In individuals with diabetes, the body either doesn't produce enough insulin or doesn't use it effectively, causing glucose to build up in the bloodstream. This leads to elevated blood sugar levels, a hallmark of diabetes. But it's not just about high blood sugar levels. Excessive sugar consumption can contribute to weight gain, which further increases the risk of insulin resistance and exacerbates type 2 diabetes. Moreover, a rapid surge in blood glucose levels can lead to a state of hyperglycemia, which, if persistent, can damage various organs and tissues over time. Even our dental health isn't spared. High sugar intake can increase the risk of dental problems such as cavities and gum disease, especially if oral hygiene is not maintained. Given these implications, it's clear that managing sugar intake is of paramount importance for individuals with diabetes. But does this mean diabetic patients should completely avoid sugar? Not necessarily. The context of sugar consumption is crucial when it comes to diabetes management. The type of sugar, the timing, the quantity, and even the accompanying nutrients matter. So, while limiting sugar intake is generally recommended, there are situations where sugar can and should be included in a diabetic patient's diet. So, we now know that sugar plays a crucial role in diabetes management. But under what circumstances can a diabetic patient take sugar? Not all sugars are created equal. This is a crucial concept when it comes to managing diabetes. There are two main types of sugars to consider: simple sugars and complex carbohydrates. Simple sugars, like those found in candies and sugary drinks, are broken down quickly by the body, leading to rapid spikes in blood sugar levels. This sudden surge can be problematic for those with diabetes, as their bodies struggle to regulate their blood sugar effectively. On the flip side, we have complex carbohydrates. These are found in foods like fruits and whole grains. They contain fiber, which slows down the digestion process and allows for a more gradual release of energy. This slow and steady release helps to prevent sudden spikes in blood sugar, making complex carbohydrates a safer choice for those managing diabetes. So, the type of sugar consumed can significantly impact a diabetic patient's health. Remember, when it comes to sugar intake for those with diabetes, the type of sugar matters. Meal planning and carbohydrate counting, two essential tools in a diabetic patient's arsenal. Distributing sugar intake evenly throughout the day, especially in the context of well-balanced meals, can help manage blood sugar levels. When sugar is consumed with other nutrients like protein and fiber, the absorption of glucose slows down. Thus, the spikes in blood sugar levels are less drastic, making it easier to keep your blood sugar under control. Now let's talk about carbohydrate counting. This involves understanding the total carbohydrate content of a meal or snack, including sugars. It's like a roadmap to your meal, guiding you on how much insulin your body may need to handle the food you consume. It's a way to keep your blood sugar levels stable, preventing those unwanted highs and lows. Remember, balance and understanding are key when it comes to managing diabetes. Scene script: exercise and hypoglycemia, two situations where sugar might be necessary. Let's dive into the world of post-exercise sugar first. Whenever we engage in physical activity, our body's sensitivity to insulin heightens. This increased sensitivity helps our body utilize glucose more efficiently, fueling our muscles and keeping them in peak performance. But what happens when the workout ends? Our bodies need to replenish their energy stores, and this is where a small amount of sugar comes into play. Consuming a little sugar after exercise can help refill the glycogen stores in our muscles, preparing us for our next workout and preventing excessive fatigue. Now, let's shift gears and discuss hypoglycemia, a condition characterized by dangerously low blood sugar levels. Symptoms of hypoglycemia include shakiness, confusion, and dizziness, and if not addressed promptly, it can lead to serious complications. In these circumstances, a quick dose of sugar or fast-acting carbohydrates is not just beneficial, it's essential. This immediate sugar intake serves as a rapid fuel source, helping to raise blood sugar levels quickly and effectively, alleviating hypoglycemic symptoms, and restoring normal body function. In both of these situations, sugar acts as an essential tool aiding in recovery post-exercise and combating hypoglycemic episodes. But remember, the key lies in moderation and understanding your body's unique needs. So, in some situations, sugar is not only acceptable, but necessary. Moderation, a word that holds significant meaning for diabetic patients. Just like the rest of us, those living with diabetes can enjoy the sweet things in life, but they need to be mindful about the quantity and the context. When we talk about moderation, we're referring to the idea of balance. It's not about cutting sugar out completely, but about consuming it in small amounts and as part of a healthy, balanced diet. This balance is the key to maintaining steady blood sugar levels and preventing sudden spikes or drops. Now you might be wondering, what does moderation look like? Well, it's not a one-size-fits-all concept. It varies from person to person based on individual health, lifestyle, and dietary needs. However, a general rule of thumb suggests that added sugars should not exceed 10% of daily calorie intake. But remember, it's not just about the numbers, it's about making smart choices. Opt for natural sources of sugar like fruits, vegetables, and dairy products over processed foods with added sugars. Combine your sugar intake with proteins, fibers, and healthy fats to slow down glucose absorption. And don't forget to factor in physical activity, which can help your body use sugar more efficiently. So while managing sugar intake is crucial, it doesn't mean a complete elimination. It's about understanding, planning, and moderation. The goal is to enjoy a varied and enjoyable diet that supports your health and well-being, while keeping your blood sugar levels in check. So, can diabetic patients take sugar? The answer isn't as simple as a yes or no. The type of sugar, meal planning, carbohydrate counting, post-exercise sugar intake, and moderation all play a part. Individuals must also consider situations like hypoglycemia. It's a delicate balance, but with careful management, it's possible. Remember, every individual is unique, and so is their diabetes management plan. Always consult with a healthcare provider for personalized advice. If you found this video helpful, don't forget to subscribe, like, and share it to help us reach more people. Stay tuned for more informative videos from Medicine Health 360.